expensive, right?
Yes.
Hello? Just. You're right. Good evening, good afternoon, good morning, where are you from? Just type in where are you from. And I love EduSkills OET, some hearts, some smileys. Yes. Yeah. I'm waiting for the comments. Yes, Dr. Zagir Shah. Yes, Father, we are here. Yes. Sneha Pambali. Yes. Lee Prabhakar. Yes. Zulu. Yes. Rohina Patan. Inam Ola. Faisal Raza. Type in. We are waiting 2 minutes to people to join in. Share to your contacts. At least we had a mission, each one reach one. Okay, every day. That's our mission. Yeah. If anybody is on duty, please join from YouTube. Okay.
Father, I think you're muted, Father.
Okay. Okay. Cool. Just speaking about our mission, we had a mission from the very beginning, each one reach one. Every day we reach one person. Yes. So try to send to at least one person and invite them. Yes. And any concerns, you can type in the YouTube comment space if you want me to clarify any doubts. Yes. All those who don't respond and attend sessions will be removed from the new batch because there is no meaning in being there. When spammers are there in the batch, admins were reporting, even in the new batch. So those who have no response will be removed from the batch because there is no meaning in keeping them and wasting admin's time. And unless you share to the contacts, it happens in some batches. People will be very less. You see, at least if there are 100, if there aren't 100 people, we are not going to spend the money and waste the time. Okay. There are 400 people in this one. We don't think even 50 are there here attending. Otherwise, people can go and watch the YouTube videos and succeed. So it's also your responsibility to work active to see that there are sufficient people. Every day we are going down the participation. Then I will lose my motivation. I can do better things for other people because people are asking sessions for IELTS and other courses. And IELTS was our main platform, not OET. Where the interest is more and people are benefiting more, we lean on that side because we are supposed to choose the greater good. When there are two good things, we have to choose the greater good. When there is good and evil, choose the good. And when there are less great evil and small evil, choose the smaller evil. Among the good, you have to choose the greater good. Okay, and I have given a concession, these 2 sessions. Next session onwards, it will be cancelled without saying if there are no sufficient people responding in the YouTube comment space. If there aren't at least 110 people, we will cancel. Automatically stands cancelled, no announcements will be there. And again, if there aren't at least 200 likes, okay. When we are spending time, you also supposed to do something for the mission, right? Yeah, all those are not. Yeah. So it stands, you can write down on your notebooks. If there aren't sufficient people, the sessions will stand cancelled without prior notice. And also, if there aren't at least 200, this was agreed upon in the even before prior sessions. If there aren't 200 likes at least, we will stop the session because we are supposed to reach out to the maximum struggling people. I don't think we are reaching. We are reaching to the rich. We will be cautious on that. And those who come here and do other duty, muting yourself, your videos, you will never be admitted again. Please take care of it. If you are on duty or if you cannot attend, please go to YouTube Live and watch there, okay? Are you all ready at YouTube? Tell me. Take up some snacks. Yeah, I would like to join you tomorrow. Sorry. Okay, cool. That is fine. No problem. I love OET and Edu Skills. Number is okay. Cool. All are welcome. Yes, I want to join EduSkills 70. Thank you. Yes. Suman Patan. Thank you. Yes, Shubham Pal. Yes. Okay, let's have a minute silent prayer. Yes, good evening and welcome to EduSkills OET Made Easy. Our mission is to make you fall in love with OET. If you're watching this on YouTube, kindly consider subscribing the channel. Give us a thumbs up if you like our work and share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially and emotionally struggling to crack OET. Our tagline is to empower each other and grow together. So let's grow together. All the services at EduSkills are. Give us a thumbs up if you like our work and share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are. Please mute. There is some instrument. Secondary instrument, please mute. Okay. Cool. It's okay. Yes. Okay, today we'll be again in the initial stages. We'll be looking into reading part A. Skimming and scanning will be practiced. We'll also be giving you some more tips, super tips on cracking part A. And don't think when you go with the part A, it's only about A. It's all about all the 4 subtests. The competency is required for all the subtests. Am I visible at YouTube? Am I visible and audible
Not
at
yet,
YouTube? Not yet. Okay, let's wait. Let's wait.
Now,
Okay, okay. Right. Yes, keep smiling. We'll enjoy the session today. Let me share my screen. The screen has reached YouTube. OET 2.0, day 6. Okay, this is the 6th session. If you haven't watched the previous sessions, please go to YouTube and watch them. Otherwise, you may not understand the upcoming sessions as well. OET skills, practice with mentor, reading part A, total knee replacement is the topic that we are going to take up today. We will not be dealing in detail. I have already sent the materials. If you have the materials, please have the copy with you. Or in the second instrument, you can keep it open. Okay, 9 steps to crack reading part A in 10 minutes. Maybe you'll find in some classes 10 steps, some classes 12 steps. Maybe I subdivide one step into different steps when I see some doubts in the YouTube comment space or in the main platform. That's why we have different steps. Sometimes people don't understand a particular step. So what I do, I subdivide it, explain it in more detail into 2 or 3 steps. So don't worry, I have told you 12 steps. Now it is 9 steps to crack reading part A in 10 minutes. That's our target, within
Sorry,
10
Father.
minutes.
We can see on the screen it's answer key.
Okay, let me share again.
Yeah. Yes, now it's 9 steps.
Okay. Let's wait. Yeah, you can see in the YouTube, right? Just type in if you can see my screen. Always you can interrupt me, okay? Because of internet issues, sometimes you don't see the screen. If you don't see the screen, you will not understand what I'm explaining. I'll try to go as slow as possible. I'm going
Yes, now
fast
it's
also. Yeah. I had already sent text at night as well. Okay. Asha Akbar, are you in? Yeah, we will see. Yes. The first step, identify the 4 text headings and write down on a piece of paper or on your notebook. Okay. Understand the sequence among the 4 text headings, which I have already explained in the previous sessions. Write the 4 text headings on top of each page. Skim the 4 texts, highlight the clue words. I have said what is skimming: title or heading, section headings, subheadings, names of device, instrument, or body parts, whatever, medical councils, any names, numbers or percentage or age, date, all this. Sequential expressions like firstly, secondly, initially, later, all those things. Frequency expressions, very often, random or very rarely. Scale, we have not looked into. Abbreviations. There will be some other things in other classes, but I have not included all. There are 12. Now you'll be confused. We'll be focusing on certain things. As we go on, we'll teach you about scale and other expressions. Okay. 5th one, match the 20 question statements with the 4 texts. Okay. After skimming the 4 texts, you have highlighted the clues. Okay. Then you match the 20 question statements with the 4 texts. Actually, for the exam, you have to match only 1 to 7, the first portion with the text. But I suggest for competency purpose, you match the heading, match the question statement with the text A, B, C, or D, whatever the text. Okay. Then you go on to answer. 6th step, scan the text to locate the answers. Now we'll be going into that particular, you have already written in front of each question, it is from C or D or A or B. So immediately go to that particular text and scan that text to locate the answers. 7th step, write the answers in the answer booklet. Okay. 8th is proofreading, very, very important. There will be some spelling mistakes in a hurry or you are in exam anxiety. So proofreading is very, very important. Keep at least 2-3 minutes for that purpose. Fill in the self-assessment form. When you are under training in EduSkills, you'll be giving a self-assessment form when the full text is being done. Now it's okay. When we start practicing the whole text, then we'll give you the self-assessment form where you can fill in the score. Okay, method for reading part A, you know, TQT method. I'm not going to explain it because I have already explained in the previous sessions. Text, you skim the text, do the analysis, question analysis, then come back to the text to scan the text. Okay. Step 1, identify 4 text headings and write down on a piece of paper. You know, today's total knee replacement. This is text A. This is text B. This is text C. And this is text D. It must be. It is written 4. That is a mistake in the spelling. Just have a glance and write down. If you know, you can type in the comment space what could be the total. Don't write the heading as total knee replacement. That is a common heading for all the 4 texts. Write on a notebook, total knee replacement. So what could be, just glance over and write down or put in the comment space what could be the sub heading for this text A or part A, whatever. Text A, what could be the heading? Write down or just type in the comment space, YouTube comment space. Okay. We're moving to next. Hope you have written down. I'm waiting at the comment space. What is your heading for this particular text A? Just read the first sentence, you will understand. Okay. Okay, definition, and why performed. Okay. Jaya Kannan, total knee replacement is the common heading. Okay, that is the heading for all the 4 texts. Text A, text B, text C, and text D. But you have to find a heading for this particular test. Okay. Our definition, description. Okay, description, definition. I don't distinguish. They are different. But for understanding sake, you can keep it as definition or description, whatever you want. We are going to text B. Okay, text B. You remember the clues, how to find out the text headings. Description. Okay, we are in the text 2 or text B. Okay, text B. What could be the heading? Okay, heading assessment. Yes, Dr. Zigar. Yes, assessment or clinical assessment. That is cool. Yes, yes, clinical assessment. Text C. You know the clue. If there are more than one side heading, subheadings, you check whether they are different. If they are not different, you can take one. If they are different, you will have to merge both of them together. What could be the next heading for 3? Text 3 heading. Clinical assessment. You are all right. Text 3 heading. Yes, complications. Okay, potential complications or complications. Cool. If you can remember complications, that is fine. Complications. Yes, that's great. Yes, you're right. We are going to text 4 or text D. We'll be using it as text D. Okay. Text D, postoperative. It's not postoperative complications. It's postoperative. Come on, postoperative care and discharge plan. Okay. Do you have discharge plan here? Okay. Postoperative care, potential complications and other potential complications. Test name, you need not write potential complications and other potential complications. It's not required because as health professionals, when we say potentials, you know. But then keep that also in your mind so that if the question asks other complications, you can answer immediately. Yeah, that's cool. So you have all the 4 headings. Total knee replacement is the main heading. And first one is definition or description, whatever you want to say. Okay, second one is clinical assessment, text B. Text C is complications or potential complications, whatever. This is only for your understanding, nothing to do with the OET exam, okay? This is to gain competency. After gaining competency, none of these steps are required. You will simply swoop into the things, and simply the answers will blink like bulbs, and you will immediately write. Okay, text D, post-operative care. Yes, you are right. Yes. Now, next identify 4 text headings. Write out on a piece of paper. This total knee replacement, that should be there when you write in your notebook. On top of each page, you can write only the 4 texts. Text A, definition. B, clinical assessment. C, complications. D, post-operative care. Okay, that's it. Now, step 2, understand the relationship or sequence among the 4 text headings. You have to understand there is a connection, definition, clinical assessment, complications, post-operative care. There is an ascending order. I think in the second or third session, I have clearly explained around the 9 steps, ascending order, starting from patient admission, what happens, the process. So here you have definition, then you have clear assessment, then you have something about complications, then post-operative care. So step 3, write the 4 text headings on top of each page. You have to write on top of each page as it is shown here. Okay. Yes. So that must be your business in this stage. Write on top of every page. That's important. Okay. Even if you remember, see that you write down. Total knee replacement. Okay. Definition. Sorry. Let's try to skim this text. I will put it in escape mode. Oh, sorry. Some issue with my sharing. Okay. Now let's shout. You can type in post-operative care assess. If we write headings on each page, we waste our time, or we can manage. Okay, come on. We can manage. Okay, somebody is commenting that we'll be wasting our time. You need to ensure to wasting your time. You are using your time. Okay. Now this is to drill into your brain. I said as during examination, you can do it or you need not do it. It's all up to you. Once you are competent, you need not do any of these steps. These all things for competency. And if you feel the other way about, you are following some other mentors, you are most welcome to follow them. We don't mind, but don't advocate that at our platform. Okay, this is proven steps, scientifically proven steps. Okay, I can understand that is your confusion, but then do whatever we say if you want to be competent. I know it's not less than 10% of the people do that and they succeed. Cool. So let's see if you can glance over what is supposed to be highlighted. Somebody tell me. You can shout out at the Zoom. Others can type in the comment.
Names.
Okay. Yeah. Total. Yeah. This is both name and abbreviation. Okay. Then
Numbers.
where is number?
Artificial joint for the second line.
Second line number is there.
No, artificial joint.
Artificial joint. Yeah, artificial joint organ, body part, right? Yes.
Yes,
Damage.
Damage.
Yeah, damage, cartilage and bone. Yes.
Knee joint.
Again, yes.
Metal
Yeah,
and
that is.
plastic.
Yes. Knee joint is.
Plastic, metal,
Metal, plastic.
Replaced with metal and plastic. Yeah, that is not exactly the name of an organ, right?
Osteoarthritis.
You can highlight if you want. You can highlight, but then metal and plastic. Maybe for a purpose you can highlight it, no issue. But then it's not it doesn't come under our clues. Yeah.
Osteoarthritis.
Rheumatoid arthritis.
Osteoarthritis. That is name of a condition. Name of it.
Rheumatoid
arthritis. Knee injury. Knee deformity.
Knee injury.
Knee deformity. Okay. Rheumatoid arthritis. Yes. Rheumatoid arthritis. Yes. Then,
Medication, physiotherapy, and lifestyle changes.
okay, medication, physiotherapy, and lifestyle.
Lifestyle changes.
They come under treatment. Our clue is treatment or intervention. Yes.
First choice. First choice.
Proceed. Yeah, here small. This is
Smaller
procedure.
operation.
Small operations procedure. Name of it procedure. Yeah. Include
Options include arthroscopy,
washout and
okay,
debridement,
Okay. Okay. Yes.
partial knee replacement,
Arthroscopy.
PKR, Replacement.
Yes. Then yeah, micro.
replacement.
Yeah, this one has to be one second. How do you say that? Microplasty, right?
Mosaic.
Mosaicplasty. Mosaicplasty. Okay. Thank you. Mosaicplasty.
Partial knee replacements.
Okay, partial knee placement, PKR. Abbreviations are important, I said. Abbreviation and name together. When there is abbreviation and name together, very, very important. Okay. Then
Full
joint replacement.
full
Alternative.
joint replacement. Okay, alternative, where is it?
Same
Alternative, yes.
Last
Alternative, yeah.
In front of
When alternative option, almost like our pet name, okay, alternative name, another name, okay, yes. Then
20 years.
20 years,
20
years.
years, yeah.
60 and 80.
60 and
60 and 80.
60 and 80, yes. Then
However,
However,
their quality of life and their
yeah, we are not going into all the clues since for the beginners, there are so many other clues, I know, but we are focusing on the easiest ones in the initial stages. But with this, you can have all the answers.
Father, younger people,
Where is it, younger people?
the 60 and 80, the same line, Father.
Okay, younger people, okay. Most people and all, I did not look into scales. I am not highlighting it now. As for, there should not be any confusion for beginners. That's why it's cool. We'll come back. Okay, anything else? However, is there, quota word is there? Those things will come back. Even otherwise, we can find almost all the answers, probably. Is that cool? So the skimming is done. Okay. Yes. And now to highlight this, sorry, just show you what are the also continues to share. Okay. What are the already the 4 headings are there on top. Now let me show you probably what are the name of a procedure here, total knee replacement. Then name of a body part. One is knee joint. Second one is damaged cartilage. Another one is bone. Then name of a disease, that is osteoarthritis and rheumatoid arthritis, knee injury, all those things.
Injury, knee deformity.
Again, name procedure. Okay, that is partial knee replacement and mosaicplasty. Yes. Then sequential expression here, first choices. Then you have abbreviation PKR. Here also you have TKR. Here you have PKR and TKR. Let's see whether they will be the answers. Time expression, 20 years already you said. All these are mentioned by you. Numbers 60 and 80. And one I left to highlight, physiotherapy and lifestyle changes. That is actually intervention or treatment, medication. Comes under medication. I did not highlight this. Highlighted, but then I have not put into the this one, clue word. So this is the idea. This is how you have to write down as you go on reading. Write down these things with a different color pencil or pen in on your hard copy. Okay, and put all these arrow marks, circulate, and whatever you can do. Okay. Step 5: match the 20 question statements with the 4 texts. To save the time and to give you practice, I am not going to match everything. I will match now this particular text. Okay. And out of 20 questions, you have 6 questions from this one text, okay? Out of 20 questions, and we'll see whether we have highlighted the answers. We never knew the questions. Now, could you tell me what is important here in the question? Oh, sorry. I have some problem with the sharing. Yes. What is important in the question?
Write down the text name.
Smaller
Yeah,
operations.
no, no.
operations.
Smaller operations. Smaller
Alternative.
operation. One sec.
Alternative.
Alternative.
Check. One check my rows. Yeah. Okay. Knee replacement or smaller operations.
Operations.
Alternative.
Okay.
Alternative.
Alternatives to knee replacement. Okay. Smaller operations. Then total. What is total knee replacement?
What
Where is it? Where is it given?
Alternative.
A.
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 Smaller operations.
A.
PKR.
A.
Partial
TKR.
A.
The parts of an artificial knee joint may be held in place with dash.
A.
Okay. See, or newborn growth we have highlighted. Okay. Then dash and lifestyle changes are the first choices for. Again, it is. Yeah, what I said, I did not mention it. Yeah. So easy it is. 7 you have to write only. These are not 7-1, but these are taken from different questions. I just to confuse you, I gave you continuous numbers. These are the third question, 7th question, 9th question, 12th question, 17th question, and 20th question. And when you go to the text, and here, smaller operations and alternative to knee replacement is answer is a name procedure. We can also say pet name or alternative name. What a total replacement is, name, disease or condition. What do the initials PKR stand for? Again, name, disease, condition. What is the main reason a TKR is carried out for? Name, disease, condition, and scale is there. We are not bothered now. Then the parts of an artificial knee joint may be held in place with dash or new bone growth. Name and conjunction or list. As I said, if there is a list, that will be the answer. Here also again list you have, 2-3 things you have. Medication, then there is something else, and lifestyle. Yeah, physiotherapy and lifestyle changes are the first choices for managing the knee symptoms. Conjunction or list. Whenever there is a list, I told you there are 2 lists here, and 2 of them are the answers. If there are 3 items, 1 will be the answer, or 2 may be the answer. 2 words. Okay. So that is it. Let's see how it goes. Okay. So these things also you have to write down, okay? And as you practice in their stages, practice with these things. Write down in front of the questions. Now all these are from text A. Now step 6, scan the text to locate the answers. Okay. This is third question. Smaller operations has alternatives to knee replacement. And where is it? Smaller operations here already highlighted, right? Smaller operations. Yes. So cool. 7th one. What a total knee replacement is?
First line.
First line. Yeah.
Second
What?
line.
Yeah.
First
Surgery
and
is a
second
major.
line.
Yeah. Second line. So it is there. It's just to tell which text contains it. So cool. Okay. What do the initials PKR stand for? What is the full form of PKR? We have already highlighted, and I said. Yeah. Where is it? He is a partial PKR. Already, if you highlight by PKR, that's more than enough. Okay. Or PKR is an answer. TKR is an answer. Okay. Then 12. What is the main reason a TKR is carried out for?
Osteoarthritis is the main reason for a TKR.
Main reason.
No, sir.
Is the main reason.
Second line.
Osteoarthritis main reason.
First
Okay.
paragraph.
Second,
last.
third line.
Paragraph.
Second and third line.
Sentence.
Osteoarthritis
Okay.
next.
Cartilage and
Fifth
bones
line,
are
fifth
removed
line.
from
Sixth
the
line.
surface of the knee joint.
Yes, osteoarthritis is the main reason.
Osteoarthritis
Main
is
reason.
Yeah.
Okay. Main reason also scale is there. Later we will learn. But then I just want to tell you with these simple clues, you can find almost all the answers. Okay. This is the first one. I did not select any first text. 17th one, the parts of an artificial knee joint may be held in place with dash or new bone growth. Again, a list. Okay. Where do you have?
Cement or newborn growth.
Fourth line.
Yeah.
Cement
Cement
with cement or newborn growth. With cement or newborn growth. Fourth line.
Cement. Yes, Father.
Fourth line. Okay. Fourth line, right?
You have to write only
Yeah,
cement.
cement or new. Yeah, cement is the answer. Cement or
Cement.
newborn growth. That is again list or another thing or conjunction.
Or
Yeah, 20th one. Dash and lifestyle changes are the best.
Medication and
Medication,
physiotherapy.
Yeah,
physiotherapy.
see medication, physiotherapy. I left medication to be highlighted. Physiotherapy and lifestyle change. Medication and physiotherapy is the answer, and lifestyle changes. A list of 3 things. 2 words are the answers. How beautiful, how simple, how beautiful. Provided you have patience and practice, it becomes so easy. You need not go into any steps once you are competent. As you just glance through, you will have all the answers. With this one text, you have 60 marks, right? That can be within these 6 questions. You don't require even 2 minutes once you are competent, because immediately you will know the answers. Where is the answer? Okay. 7th, write down the answers in the answer booklet. Okay. You have to write down in the answer booklet. 8th, proofreading, I said, very, very important. Don't neglect it. Even during your practice, do it. Then only you will develop that skill of proofreading. Identify if there is a spelling mistake, or you might have written a repeated word or anything. Check it. Take time and check it. And if there is, you share in the platform so that others also will be alerted on such mistakes. Then fill the self-assessment form. Later we will introduce into that. Okay, now B and C for your practice. Okay, D we have already done it. Do you remember?
Yes,
Yes,
Father.
Father.
Yes, Father.
Yeah.
Yes,
We'll
Father.
just have a glance over it. Okay, just to revive your memory. See how we have highlighted. We are not going to do it together. We have highlighted. Okay, hold on, Jesse. What is this? First to highlight. What clue is this?
Name.
Name.
Name of
Name, Father.
A drug.
drug. Yeah. Okay. Then you have abbreviation. Then you have numbers 24 to 48 hours. Okay, duration. Then deep vein thrombosis is name again.
PC.
Condition. Intermittent food soul pump is the name of the equipment. Then again you have 12 to 18 hours. Number. We have CPM machine. Name, abbreviation, name. Okay. So beautiful. And coming to the timeline to full recovery, post-operative care following knee replacement. What type of analgesia? See, PA, CAS. Whenever there is abbreviation, there is an answer. So easy it is. And you see the name of, see what is the minimum knee bend a patient should have on discharge from hospital?
90 degree
90 degree angle.
Yeah. Where is it? 90 degree?
Discharge.
Discharge. Below that discharge.
Okay. Yeah, 90 degree. Yeah, 90 degree. See, that's a number. That's a number, right?
Yes,
Again, deep vein thrombosis is a name. Prevention options includes use of dash pump. Name of a pump.
Intermittent food salt.
That's all you find. You don't find many other names. Yeah. Then you have on discharge. When you know on discharge, at discharge, immediately you go there. You don't look anywhere here. Immediately you go to discharge. On discharge, most patients are able to walk dash and go up.
10
meters.
While reading, it must be a distance. So 10 meters, again, it's a number. It's a distance number. So exactly, not once in text, every text gives the same idea. How sweet and wonderful if you just dig into it. See? Post-operative care heading or title, and opioid analgesia, name of a drug, and intermittent food, soul pump, name of a device, then subheading or side heading or sequential expression here at discharge, then again number, 90 degree angle, 10 meters number, timeline to full recovery, subheading or side heading at the end. Yeah, so beautiful. See, timeline to full recovery, then there is a big table. You don't require to look into at all. People don't get time because they will be searching everything here. Because there is no question regarding this table activities. Only the heading of the table, time to full recovery, that is mentioned. That too, just to match the paragraph. So these are the answers. So cool. Second one comes from a timeline for full recovery. That is the last heading, second subheading. Then operation recovery following knee replacement. That is D. Again, that is the heading. And type of analgesia, the PCAS. Okay. And on discharge, 90-degree angle, interval full sound. Again, I'm telling you to tell you this is the thing. Nothing else. You have to practice this. Search for these things. Those are the answers. You don't even look into the questions. Once you're competent, 99% you will have the answers without looking into the questions. And usually with the great batches, what I do, I give them a task to create questions. Highlight the clues. I won't give them the questions. I will give only 4 texts. Then I ask them to create 20 questions. Do you understand?
Yes.
Yes,
And
Father.
I tell you more than 15, 16 will be right. They will have done the same thing because you know what is going to be the answer. Those are the only questions they can ask. Those are the strategies. Or in your language, those are the tips. Okay? And always, this one you beware, write it again, always think. Most of them will lose their score in these problems. Copy and paste your answer from the text. Again, there are concerns being asked. That's why I'm repeating. Copy and paste means you can't change anything. When you copy and paste, nothing changes, right? So exactly what is given in the text, nothing else, extra or less. You can't remove anything, you can't add anything. Fill in the blanks, no repetition of words that I have explained. And say like pump, you can't write. Okay, define thrombus prevention options include use of dash and pump. Intermittent foot sole is the answer, not full sole pump. People will think it is so easy, so they will write in the answer booklet intermittent foot sole pump. That is wrong because it repeats here. Pump it will become. Okay, that is wrong. So answer should be only intermittent foot sole. The doctor advised her a dash test, not a blood test. Blood test is wrong. Answer is blood test, but your answer must be just blood because test is given after the gap. Otherwise, when they read, it will read like the doctor advised her a blood test. Doubling, we call it doubling is a mistake. Normally, we don't remember. That's why I said proofreading is important. Okay, check out these things. When you have such things, maybe blood, you don't understand, you just check what is there after the blank. Make it sure. If it is blood test, make sure test is not there in the question booklet. Okay. Now missing words. Okay. 90-degree angle, 90 degree is wrong. What is the minimum knee bend a patient should have on discharge from a hospital? People will write 90 degree. Oh, correct. No. 90 degree doesn't give the meaning. 90-degree angle is the right answer. That's why people say exam was so easy, but I didn't get the required score. Other exam was very easy. Problem is this, very easy because you know the answer, you got the answer, you located the answer, but you did not write the answer properly. Okay, no typos. Typos means spelling mistakes. See, what is the mistake here? This is wrong.
Yes, Father.
Analgesia. A-N-A. Yeah, but these are the important words. So one spelling mistake will lose you 10 marks. So opioid it is. Opioid. O-P-I. Analgesia. A-N-A, not A-N-E. Okay? Beware of those words. That's why I said proofreading is very, very important. Check with that text and the word. Already it is given in the text. Then how can we make mistake, right? So that's what I stress, copy and paste, not even a single difference or a single spelling difference. Okay. 10 meters, wrong. 10 meters as it is given in the text, M-A-T-E-R-S. That is right. Yes. Do you want me to visit anything? Now B and C is the task, okay? B and C, task for you. I have already posted. Hope you have the materials.
Okay, Father.
Yes, Father.
Yeah, and next time, yeah, if you want me to visit any of that, this one, otherwise I'll stop sharing. Now, these things are so beautiful. What I invite you, just post in the platform or make a list there. Next time, if you can explain one question answer from a party, there are 20 questions, no? Any one which you liked, one bright tip that you got. If you can explain, that will be great. Any of these days when it's convenient for you. It can take 2 minutes. Okay, that will give you real confidence as well and clarity. So let me know who all can do it, okay?
Okay, Father.
Okay,
Just one
Father.
question. You can choose any question, but then let's know so that you don't don't repeat the same question, okay? You can post it in a list over there. Maybe admins will initiate it. Then you can post this question, 18th question I would like to, okay? So we'll order it. So we will give you the chance according to the order. That gives a lot of clarity. That's why we have included in our training program. This sort of teaching once is equivalent to learning 50 times. That gives a lot of clarity. Yeah. Take one question or two questions. You can even take 10 questions. Okay, no problem. But first come will be first served. Only 20 questions are there. If the 20 questions are complete, you cannot repeat the same question as of now, because we give you next time chance. I hope there will be people for all the 20 questions of this particular party A. And take patience.
Yes,
Don't
Father.
worry. You don't worry and go and do all the materials. I have already posted the videos, small videos, around 32 videos. All those videos are very, very important for gaining competency. Those are very small videos. Actually, one session I made into 8 videos or 9 videos to give clarity. Okay. And see that your registration number is typed in the comment space so that we know you are following properly. So that will be able to guide you efficiently. Any other clarification? And I'll be coming back with the clarifications in the next session. Maybe the 14th question was there. I did not take the material today. I just remembered when I started the session, 14th question of back pain, right? There are some clarification. List all the clarifications admins will give me, and I will get it to you. Yes. Today I was on a tight schedule, so preparing PPTs take a lot of time. Any other discussion? Yeah. I think we'll go to somebody who wants to present a short presentation today. Let's see who is that.
Kasturi, Father.
There is Kasturi. Let me locate
Here,
her.
Father.
Yeah. Where is it, Kasturi?
Here,
Can
Father.
you raise your Kasturi? Yes. Good smile. Yes. Yeah. Great. That is nice. That's what we love. Yeah, maybe you can introduce after that. Minnie Jackson, admin Minnie Jackson will share the screen for you.
Okay, Father.
Yeah, you can speak anything, okay? Anything, whatever, to inspire everybody. Yes, Kasturi, you're welcome.
And
Yes. Oh, sorry. You're a co-host, right?
No, but in between I lost the connection.
One sec. Give me 1 sec. Yeah, all are allowed now. I'll make you co-host. Don't worry. Yeah, you are both now. You are allowed otherwise and co-host, no problem. Yes. Yeah, after our introduction, you can share, Minnie.
okay, Father.
Yes.
First of all, I would like to thank EduSkills and Father also, because before I started from February to learning the OET. I feel so hectic, Father, when I started, because I cannot identify those things. The OET, because it's really new for me. The OET listening. From the school onwards, I studied in Tamil medium, so English is so difficult for me. But now, after I see all your videos from February, now I have some confidence to achieve OET. I need some more confidence. Then only I join to your team. And I don't know, Father, what I need to speak. I cannot hear your voice. Father.
Okay. We will share the screen. It's cool. We will share the screen. You can explain, okay? In between, whatever comes to your mind, you can. Mini, please.
Is it visible? Yes.
Yes, ma'am.
Yes, Mini.
Yes,
Yes.
sister.
Make
So
it big
shall I-
screen. We just click on that bucket icon below.
We can able to see further, I think.
But then you can click that bucket icon and below or slideshow on top. Bucket icon is below here on the right side. 77% is written there, no? Just left to that, close to that. Not only for Kasturi, for every day she has to do it. Did you see, Mini? Am I audible?
Yes, Father.
Yes, yeah. Lost. One sec. She will be sharing.
This icon is, but
Yes. This icon below, there is 77%, no? Minus and plus is there. On the right bottom corner, that item. Yeah, this item. That's it. Yeah. Click it. Click.
Oh, yes. It's a full screen, Ajab, now.
Yeah, it's coming. It's coming. It's not at reached. We are one sec. Wait one sec. Is it full screen for others?
Yes, Father.
Yes, Father.
Yes, Father.
Okay. Okay.
It's not the full screen. The screen is like the split. The
Mini,
slides are showing in
did
there.
you click that button? Mini, did you click that button? Which
Yes,
you should.
already I clicked the button. It's I can see that it's a full screen here.
It's not full screen. Go to slideshow on top. Go to slideshow. Click that slideshow. No. Slideshow. Not there, ma.
Yes, this one is Ajab.
No, ma. Slideshow. First one is home, insert, design, animation, slideshow.
Normal slide sorter, then slideshow.
No,
It's
Mini. In the top, you can see that home button. Home, then insert. In the line, it's like the fifth one. It's a slideshow. Father is saying that one. You
Did
can
you
see
see?
that
It's
Microsoft.
on the top, ma. You are looking bottom.
Top of screen.
Slideshow.
Yeah.
Fifth one.
Okay,
Yeah,
here.
click that. Yeah. From beginning. First one. Below
First
that.
one.
From beginning. First one, ma. Below. First one. No. Down. First extreme corner. This side. From beginning.
Go in the
You
top.
can see
Go in the top. Yeah, you can see the after. Once you put that
bottom of the
slideshow
home. You can
in the
see home and
bottom, first one, it's a from beginning.
Below
Yes.
home. Below home, ma.
yeah.
Yeah.
You have to do this every day. That's why I'm teaching you today. Okay.
Okay.
So, because those who are using phone, they will find it difficult to read.
Yes, Father. Father, 2 persons are there waiting room. Can I admit?
Yeah.
Thank you, Father.
Yes. Did you click from the beginning?
Yes, Father.
You did not click, I believe. Try once again clicking.
Yes.
Resume slideshow below.
Slideshow that from the beginning I started that.
Click that one.
You did not click. Then otherwise, next one you click from current slide. You are not click. You are not clicking, ma. You are not clicking. You are only now you clicked it. Yes.
I can see the full screen, but I don't know whether they can see or not.
I can see full screen.
Okay.
Okay, continue. Mini, you have to check after session by yourself. Okay. Now it is not showing here in YouTube. Check in YouTube whether it is full screen. Others? Those who are at YouTube? Is it full screen over there?
Yes, Father. Yes.
Okay. Kasturi, continue. Don't worry.
Oh,
Yeah, be cool.
okay, Father. Okay, Father. This
Yes.
first slide, Father. Heaven.
Yeah, please. Mini, go on clicking.
Yes, Father.
Click the next slide. Click anywhere. It will come next slide.
You need the slide, yes?
Yes,
Yeah.
ma'am.
Now it's visible, yes?
Ma'am,
Yes.
the
You
first
go
slide.
on, Mini, you go on to the next slide, ma.
Father, I can see the first, that is a reading.
Second slide.
Second
Second slide.
slide.
Second one.
Second slide, ma'am.
It's okay.
No, mom.
No.
It is
No,
first
no,
one.
no, no, no.
You stop.
Mini,
Stop share.
just stop sharing and try to share it again.
We'll start from the current slide, yes, Acha?
Okay, ma'am. Next, second slide.
Or I will just, I'll do like this.
You do whatever you want to do. No, don't worry. We'll learn later.
Yes.
Yes, Mini, yeah.
Yeah. Yes.
Yes, yes.
So, shall I start, Father?
Yes.
Okay. I would like to share my learning experience from all the 5 sessions. First of all, I would like to share reading part A. Reading is total time is 60 minutes. Total question 42. Total marks 42. We need to aim for A grade. Don't focus on B grade. It includes part A, part B, and part C. Part A, it's 50 minutes, but we need to aim for 10 minutes. Part B is 10 to 12 minutes. Part C is 35 minutes. As we practice our father's strategy and tips, we can aim only for part B and part C. Part B is 6 minutes. Part C is 30 to 35 minutes. Part A is 20 questions, 4 text, A, B, C, D. First 5, 1 to 7 is matching, which means we need to find the hedging words and need to find the text, which text is the question. And after that, 8 to 14 is short answer and words. 15 to 20 is sentence and note completion. Next slide. Based on further strategy, we need to skim and scan the text. First, underline the heading and subheadings. If they didn't mention any heading, means we need to identify the heading based on the followings. Read the topic sentence, underline the repetitive words, look for subheadings, and combine the side headings. Next slide. Second is topic sentence, and we need to look for names, person, device, test, and disease names or body parts. Next slide. And numbers, percentage, and visual clues. Visual clue means it's synonymous and synonymous language. Sequential expression, chronology or time expression, model verb. If you use this strategy, definitely we can spend only 20 seconds for each text skimming and scanning. After that, we need to mainly concentrate on plural versus singular. Whether the question is plural means we need to identify the answer in plural. After that, we need to look for conjunction as well as searches, including or like that. And we need to copy and paste the answer. If it is filling the blanks means we need to copy and paste from the text. And we need to identify and don't do the doubling mistake like that. If they mention here dash pump means we need to write only intermittent foot sole. Don't need to write the pump again. After that, if they mention pack means we need to just write heat and cold. No need to write the packs. After that, from once you see the father's video, you need to write the synonyms and synonymous language from there in your own notebook. So you can easily identify next time you see the video, you can easily identify the synonymous and synonymous language. These are all the synonymous and synonymous language I learned from father's videos. Reason why, risk factors means causes, and light exercise means it's related to the gentle exercise. Issues means condition. Overload means increase. Allows means enable. So I would like to advise you all to read all those synonymous and synonymous language in your notebook, so you can easily remember all those things when you do the test. That's all. Thank you. That's all for.
Yeah, Minnie, you can stop sharing. Yes, congratulations, Kasuri. Well done, well done. This is what we want you to do. Definitely, you will see the improvement in your this one. And also, I understand what all things you have understood. If you have misunderstood something, like maybe you'll have to correct yourself in the regarding 2 minutes to 20 seconds. 20 seconds for only skimming, not for skimming and scanning. It's only for skimming. Okay, 20 seconds for one text for skimming. Scanning you will be doing later. That's cool. That's cool. But you have done well. That's what I want everybody to do. It can be 1 minute, 2 minutes, 3 minutes, at least one learning. This is not for teaching others, much more than that, to build up your confidence and also build up the clarity. Yes.
Thank you.
Congratulations. Yes, that's great.
Thank you.
Yeah. Any other clarifications? We have only 5 more minutes. Anything else you want to ask at the YouTube comment space? Admins, if you have some concerns, you can let me know. Headings on it.
Excuse me, Father.
Yeah, please.
Can you please share the part B and C?
Which one?
The total knee.
Okay. It is there in. Yeah, it's there in our platform. And you can just click on the name of the Telegram group. Then you will media, music, files. Just click the files. Then you have it is available in the main Telegram group.
Oh, okay, Father. Okay, Father.
Okay. Because if I give them B and C now, they will start practicing and confuse the whole thing. Because we are going step by step.
Okay, Father.
After part
Thank
A,
you, Father.
after 1 week, we'll be going to B. Yeah. You can find in the file segment of main Telegram group.
Thank you, Father.
International Telegram group. Yeah. Otherwise, some admins or somebody who has, you can ask in the group, somebody will share, no problem. I may forget it. Yeah, it is there. Commonly, it is there. If you don't find in the file segment, just request in the platform. They will get it for you.
Okay, Father. Okay.
Anything else? So you will post, right? Which question you want to explain? 1 question, 2 question, 3 question. Anything that you want to of this knee replacement, including the B, this text B and text C. You mean text B and C? It is there in our this. You mean part A text B and C, or part B and C of knee? What did you ask? Someone asked me something. Were you asking me the part B of reading and part B and C, or the text B and C?
Today we have to do text B and C. Maybe he asked.
Yeah, it is already shared. It is already shared. No, you didn't get in the main platform. It is there. Repeatedly posted. Pinned message last. Yeah.
In Telegram and file
Yes.
in main platform
Yes.
it is there. Yeah.
Yeah, the link is there. Without link, anybody can repost it. Okay.
Yeah.
It's there in the main platform.
Yeah, in main platform.
I was thinking we are asking for this one. See, link to live session, practice materials.
Yeah.
Practice materials. I am posting it again in the main platform. Okay. Select
Thank you,
this
Father.
main platform. Yeah, I was thinking you are asking for part B and C of this particular material. Yes. I have put in all the groups. Yeah. Do it with the patience, okay? Don't hurry up. Try to find out everything, discuss in the group. In all the groups, it is posted now. Part B and C, it is all together, okay? A, B, C, D. Yes, I've pinned it in the main platform. Those other admins who can pin whatever I post in other groups, whoever is there. If it is posted now, part B and C, it's all together, okay? A, B, C, D. Yeah, please mute your second instrument. Anything else? Right. See, that's because your second instrument is not muted. Lower the sound. Lower the sound of your second instrument. Otherwise, what I spoke will come after 20 seconds from YouTube again in the platform. Because there is a gap of 15 seconds to 20 seconds with Zoom and YouTube Live. You will listen to me 15 minutes in seconds in advance. Then the YouTube Live people listen to me. Yes. That's why when you keep another instrument volume high, you can listen to it after some time, as it was said now. Yes. Who is that? Venetia Lenin without smile. Yes. No signature. Hello. Am I audible?
Yes, Father.
Yes, Father, you are audible.
Yes,
Yeah.
Father.
Yeah. Yes. Speak something. Ask something. Or else we will stop. These are the golden opportunities you are getting. Nowhere else you will get free opportunities to clarify yourself, discuss yourself. People charge you for a one-to-one session for asking clarifications for separate.
Father, as you said, 1 to 20 question, when we need to do that?
Anytime. Maybe tomorrow you have a session, Manju. Do we have a session tomorrow?
Yes, Father.
Yes,
Tomorrow
Father.
Pradipha is
Father.
taking our.
Pratibha is taking, right?
Yes, Father.
Okay.
Friday
Okay.
only she
I
is.
will have to send.
Father,
Okay, you'll
tomorrow.
have to send me.
At,
Yeah.
How
Pardon?
many?
admin meeting at 5 o'clock. Pratibha told that she will going to take the class only on the Friday. And admin meeting also will be there at 5 o'clock.
Do one thing. What you can do is.
We can ask
4:30 is her session, no? Maybe it will be over by 5:15 or so.
I hope.
4:30, we'll begin the session 4:30.
Yes, yes, Father. She told
So
that.
and after that you can
Mm.
after that you yeah. Pardon?
She'll going to take only the small topic that is skimming.
Yeah, yeah. After that you can have the admin meeting.
or
Okay.
else we can ask everybody whatever time is capable, like suitable, we can finish
Okay,
it
on Saturday you can take up 1 to 20 questions. So you can Saturday these 1 to 20 can be explained.
Saturday
Sat-
Anju class is there.
Anju have the side.
Yeah,
Writing
that
It's writing.
that's
Yeah, that
so
time we can discuss.
that's okay. After that
Right.
after that we can discuss. No problem. It will not take much time.
Okay, Father.
Okay.
Father,
Right, yeah.
Father, it's a one request.
Yes.
When they are entering their name, who are want to join the Zoom section, let them tell to enter the Telegram name. Because otherwise we have very difficult. Today also 2-3 members are told they are waiting room, but I didn't see their name and some mobile number or some other name. It's so difficult to identify us.
Okay. And also those who are not active learners will not be admitting
Yes, Father.
henceforth.
Then after the
And those who
session,
leave half the way, after session they go, then you can attend from YouTube if we can't complete the session. No? And
Father,
such
one more
people we don't want, because I am sure from my experience, such attitude people will never succeed in the exams. They will come back again. And after a couple of attempts, they will cry and come back. Then they will start learning. I will be patient. I will obey. I will start. That's only medicine for them. Only experience can teach them. Yeah.
Father,
Yes.
Father,
Yeah.
then once your section started, after that also they are messaging in the main platform or beginners, they want to join the Zoom section.
Yeah. No. After time, no admissions. After 25, no admissions.
Because
And
they need
these names you take
clarification,
up,
brother.
whose videos are not on.
Okay, Father.
Now you take down the names who have not opened their videos. Don't admit them next time, even if they mention their name in the YouTube channel. Okay.
Okay,
Comment
Father.
space. Because we can't keep repeating it, no? All those people who have not
Another thing
muted.
is there, Father.
They're supposed. Pardon?
Most of the aspirants, they are not sending the learning experience in the main
Now
platform.
listen, Mini, don't confuse things. Take my instructions to take down the names of those people who have not unmuted their video.
Okay. Sir.
And take a screenshot of these people who are, those who have left early, don't admit them next time.
Okay.
Okay, Father.
Okay.
Father, Nidha here, Father. In case we want to, we want to present like one question, two question like that, we should make one slide and we should share to someone, Father, or I should talk.
Yeah. So that you can talk to Mini Jackson or Himani. They will guide you. Manju, any admins.
Anyway,
They will guide you.
I
Sharing
can
will be done by Mini Jackson.
directly sending to them.
Yeah.
Father.
Yeah.
Okay, Father.
Yeah, you can send me as well.
Okay.
At the same time, send it to them as well. Yeah, Mini will learn sharing the full screen, right? Mini and Himani will take a trial after the session sometimes when you are free. Yes, because those who are using phone find it very difficult. That's why I try to do always the full screen. Computer people can, but those who are on the phone, it looks very small. You can't read it. And it is not full screen. Yes.
Father, can I ask a question?
Yes, please. Mukta, your video is on now. I think so. Or is it a photo? Okay.
Father, actually,
please.
it's like the focus mode, so we are not able to see each other's video. Like we just can see the whoever is co-host and your video. I don't know, it's just me or everybody, but that's what
I'm also seeing like the name only. They are not opening their video, or I don't know if it is not able to do.
We can see everybody, right? I can
it's
see
the focus.
It's not showing.
It's not.
No.
Okay, that's
Yeah,
why
it's
it's actually confusing.
It's not on focus mode. If it's focus mode, you can see only me. No one else.
I can see Manju ma'am, Mini, and Nitya.
Yeah, we can just see you and co-host.
Yeah. Then in Zoom, I can see
It's
Father
not
and
in
only
focus
three
mode,
of
ma.
us.
I send you the photo, Father, on the
Why
WhatsApp.
is that?
I don't know, but I send you the picture on the WhatsApp.
Focus mode, no?
Father,
Okay,
now
I'll try to correct. I'll try to correct.
Yeah, now it's.
Now?
Yeah, now it's.
Okay. Cool.
Just now I took the screenshot
Yes.
for that.
Because somebody else was presenting. I don't.
Yeah, now I think.
Yeah.
Now it's fine. Now it is okay now.
Okay. Somebody wanted to ask me something. Who is that?
Yeah,
please.
it's Neetu. Father, yesterday, the end of the class, I asked one question like, it's from the back pain. It's like
I will get back to you,
question...
ma'am. I already announced it. I'll get back to you because I haven't got the material in my computer now. because I'm using a different system today. I'll get
Okay.
back to you with the material. Okay. Yeah. 14th
Okay,
question. No,
Father.
I'll get back to you without showing you the screen.
No, it's
You will not understand.
sorry, Father. I got the answer. Can I explain that one?
Yeah.
I got the answer. Answer is
Who is speaking?
Neetu.
Yeah, but you are not seeing. Why is that? Yeah, like your
Can you try to raise your
videos.
hand?
Need to Joy, right?
They raise the
Yes.
hand,
Okay.
Father.
Okay. Please explain. Yeah. Fine. You unmute yourself. I think my network
Unmute your
issue.
video.
Am I audible, Father?
Yeah. Yes. Yeah. You're
Yeah.
audible. I think my network issue.
Yeah. That answer is swimming, walking and swimming. In the text, they put comma. If need to put and in between walking and swimming, or we need to put a comma in between. That's my question.
Yeah, you can just post it, okay? Because without seeing the text, I can't answer, right? I don't know by heart
Okay.
what is the nature of the question. I have to understand. Yeah, actually, if there is a copy and paste, nothing can be added. But if they have changed the order of the question, I'll have to check. Usually, that will not happen in a OET material, official material, authentic material. If it has not happened, if they have given three things and is mentioned there, you can put a comma, but you can't add anything. If there is a comma in the text, you have to put comma, copy and paste.
Yeah.
That's the main
Yeah.
principle.
Comma
Yeah.
is there, but and is not there. Yeah.
Yeah.
Thank you, Father.
Question number
18.
18. Yeah. Just Himani, just remind me 14 and 18
Yeah.
questions. Yeah. I will check again, clarify in the next session. Okay.
Sure.
Usually,
Thank
no
you,
need of
Father.
any addition. Copy and paste means exactly take what is given in the text, nothing else.
Okay. Thank you.
Welcome. Yes. Yes. So we can end, I believe.
So, Father,
Yes.
you have done the part like the text A today, and text B and C. That's the like the task, right? For the today.
Yeah.
Okay.
Text B and C. Material is already posted, right? You can repost
Yeah,
it.
it's already there. Material is already.
It's all together. B and C, A, B, C, D. You can take B and C. D, you have already done D. So we need to work on B and C.
Actually,
Do
for the
exact-
18th question, a person with acute back pain should keep moving and include light exercise such
Okay.
as.
We will take it up later. Because
But
you
it's
have the
already written
material.
there.
We don't have materials. That's why.
Okay.
We can't show it. We'll discuss next day.
Excuse me,
Okay.
Father.
Yeah.
We will do part B and C in
Okay.
next slide.
Not part B and C. Text B and C.
Yes.
Text B and C, because that
Yes,
will be
Father.
confusing for others. I
Yes,
got confused
yes.
earlier. Yeah.
Yes, Father.
Text B
So
and
text
C.
B and C
Try to do all these 9 steps.
Yes, Father.
8 steps, not the self-assessment form. 8 steps at least. Exactly as
Father.
it is. Yeah. Try to write down in the same manner in your notebook. If you
Okay,
want to
Father.
make PPT, you can make PPT. They will those who have taken screenshots will share the screenshots. You can see that and do it. Yeah.
And then
Yes.
we will discuss text B and C in next
next session. Yes. Yeah. Next session. Yes. Yeah.
Okay, Father.
Right. Only in the initial stage, we will be discussing all these details. Later on, we will be discussing only those things we have. So you have some concerns, only those questions, because you'll be competent with some days. Yeah. After a week, you'll be competent regarding part A. Yeah. So, God bless you.
Thank you, Father. Thank
Yeah.
you, Father.
Enjoy,
Thank you,
enjoy,
Father.
enjoy OET
Thank
learning.
you.
Enjoy.
Thank you, Father.
God bless you. Bye
Thank you,
bye.
admin team.
Father.
Thank you,
Thank you.
Father.
Yes,
Thank you,
welcome. Yes,
Thank you,
yes.
Father.